Hi everyone, this is Utkarsh Singh and I'm here to discuss my learnings from the previous session. So first of all, we discussed about the cavities of the body. So a cavity is a space housing the internal organs of the body. Some of the cavities we discussed were the cranial cavity, which is over here. It houses the brain and the cerebrospinal fluids, etc. Then here we have a buccal cavity, which houses teeth, tongue, gums, etc. Here we have the thoracic cavity, which houses lungs, heart, trachea, etc. Here is the abdominal cavity, which houses liver, stomach, pancreas, etc. And here we have a pelvic cavity, which houses reproductive organs, urinary bladder, rectum, etc. Then we discussed about the planes of the body. So just like the 3D geometry, we have three different planes over here. First one being the coronal plane, which is here. It divides the body into the anterior, the front portion, or the posterior or the back portion of the body. Then we have the sagittal plane, which is this one. It divides the body into the left and the right portion of the body. Then we have a transverse plane over here, which divides the body into the top and the bottom parts. Next, we discussed about the heart. So the heart has four different chambers: the right atrium, the right ventricle, the left ventricle, and the left atrium. There are four different valves. The first one is the tricuspid valve, which is over here. Then we have the pulmonary valve over here. Then we have the mitral valve over here and the aortic valve over here. So what happens is the deoxygenated blood from the different parts of the body gets transferred to the heart through the vena cava. Now we have two different vena cavas. First one being the superior vena cava, which transfers the deoxygenated blood from the top part of the body, and the inferior vena cava, which transfers blood from the bottom part of the body. Now the blood is transferred to the right atrium through the vena cava, and after the tricuspid valve is open, it gets transferred to the right ventricle. From the right ventricle through the pulmonary valve and the pulmonary artery, it gets transferred to the lungs for the process of oxygenation. And after this process, the oxygenated blood is transferred back to the heart through the pulmonary vein. Now, after the pulmonary vein situation, we have the oxygenated blood in the left atrium, and through the mitral valve, it gets transferred to the aortic valve. From here, the blood gets pumped to different section of the body through the aorta, and this is the aortic valve which opens, and the blood is transferred to the aorta and then to the different parts of the body. That's all. Thank you.